today we talk about the pioneering world of surgery. And Centre for Sight in June marked its 30th anniversary. World-leading eye surgeons, clinicians and innovators came to East Grinstead for a specialist conference on the future of vision care and talking about what we could possibly see in the future, the likes of AI getting involved. And delighted to welcome onto the programme today our lunch break guest, who's been very involved in the world of sight for his career, Sheraz Daya, who joins me now. Thank you so much for joining us. Really lovely to have you with us on the programme.
Well, thank you for inviting me to join you. It's a pleasure to be here.
Let's start with you then, and where it all began for you in the world of surgery, the world of medicine. Was this a career that you'd always wanted?
Yes, when I saw my first eye operation as a medical student in 1982 in Dublin, I decided that was it. That's what I wanted to do. I always wanted to do some sort of surgery, but eye surgery was really quite fascinating. It was quite civilized. You sat down to operate. There's a lot of technology, and in those days, looking back, it was kind of medieval by comparison to what we have today. Now we have a variety of lasers to do the surgery. It's robotic, it's precise, reproducible. It's a different world. But I sort of had a glimpse into what was going to happen in the future, and that was it. That's how I made my decision. Seeing the joy of patients having their sight restored. I guess it's out of bed every morning.
So 1982, I'm just doing the maths here. That's over 40 years ago, which is quite, and so much. I mean, when you were a student there, you couldn't be able to imagine how much technology would change, and how I can see that possibly patients then would have been able to have procedures now that just would be life changing, but weren't around until more recently.
You're absolutely right. And we used to be very cautious with eye, well, we still are very cautious with eye surgery, but we used to make big incisions and we thought they were good. And we used to have, we had these stitches that were half the thickness of human hair. We still have them, but we don't use them as much now because everything is either through no incision or a very tiny incision. So you don't even need a stitch because it's so small. So things have changed dramatically in that regard. And the outcomes as a result are absolutely phenomenal. So we've also, in that time, it was always about vision restoration and preservation. Now we also do vision correction. So there's a whole new area of vision correction surgery that we do, laser eye surgery and implants and so on, to get people free from glasses and give them and increase their potential. So we have some individuals extreme prescriptions. They can't do the jobs they want. The careers they want, and we can transform their lives. So we've had a lot more happen, and our armamentarium's increased, and the volume of patients that we can take care of has increased as well. And apart from anything else, the population is getting older, so there's a lot more cataracts. There's patients with glaucoma, macular degeneration. There's so many eye conditions out there with an aging population. We're kept very busy with looking after these patients.
So you're just not just transforming sight. You're actually making sure that people can remain independent, doing what they love doing, see their grandchildren, all those things that we take for granted when our eyesight is good. But when you were there as that young student, that obviously now you've done this for many years and you've got a wealth of experience. But when you first start doing surgery like this at the beginning of your career, is it not utterly terrifying, given that if it goes wrong you have this massive impact on other people, sort of going through that learning process to be able to do this massive surgery?
No, that's a great question, and that has also evolved tremendously because we're using a lot more technology and so a lot more sophisticated, and there are a lot of simulation devices. Before, we would just sit in the laboratory with pig's eyes and practice on tomatoes and grapes, practice stitching and cutting and so on. Now we have augmented reality devices where you actually you're looking through something like a Vision Pro from Apple or with a headset, a virtual headset, and you can actually operate in simulation mode, and that's been demonstrated to improve the ability of people starting out to operate without and reduce the number of complications and issues that might come along. So it helps people get started, and it's getting better and better. You can even get transmission of micro haptics in your hands as you're operating in simulation mode. So it's again that technology that we have, the computer processing power, has improved education of eye surgeons as well. So we're living in very good times for eye surgery. It is daunting, but with the simulation, we find that trainees can take to it very, very quickly.
So 30 years of Centre for Sight and all these surgeons coming together, and a huge occasion for celebration. But at the beginning of those 30 years, are there procedures now that can save someone's sight that weren't around then? Are you performing operations that you couldn't have even dreamt about now, with meaning that there are such different outcomes for patients?
Oh, absolutely, and it changes all the time. Even just about a month ago, we did the first laser procedure that for glaucoma, and it's a £400,000 laser that's sitting in Centre for Sight in London. It was flattering to be the first commercial treatment at our centre. That's something new. There's always something new happening, and how do we choose what to do? Well, we look at it's got to make sense. It's got to make there's got to be enough evidence that this is going to work, and that's how we make the choices for what technology we adopt. But there's a lot of technology that comes and goes. We're involved in. I work very closely with industry, so I have a view forward in terms of what's coming, and that's actually how I figure out what we're going to adopt here at Centre for Sight. But it changes all the time. Even the devices that we have at the moment, we're looking at changing some of them because there are new ones coming along that are faster and more accurate. So it continues to evolve, which is very good. We want more accuracy, we want more precision, we want to decrease that bandwidth of error to get very predictable and phenomenal outcomes for patients. So we go through a lot of trouble. We adopt a lot of technology, probably more than most in the country, but we do it because it helps us look after patients and get a good outcome for them.
Stay there, because we're going to talk more about the AI and how that has transformed things. I think that sometimes we eye up AI with a little bit of suspicion, but I know that it has been quite transformative, and we'll talk more about that with our lunch break guest after the Four Talk. So lots of your questions coming in as well. This is an interesting one, because we're talking about sight, 30 years in East Grinstead of Centre for Sight, and some astonishing procedures carried out there. Sheraz Daya is my lunch break guest, who's been involved and first wanted to be an eye surgeon back in 1982. This is an interesting one. Chris in Eastbourne says, can anything be done for colour blindness? Is that something that can be cured? Any advances on that?
Well, that's not really. That's an inherited condition where there's some of the receptors on the retina, which is like the sensor of a camera, were either malformed or not present, and there's a color missing, and it can vary in degree. There's some extreme levels of color blindness. The majority of people have red-green color blindness, so they can't hard to differentiate between red and green. But unfortunately not. So there are some filters that are used on glasses that certainly help, but there's nothing that we can do for the underlying condition to correct it permanently, which is a pity. But that'll happen in time to come.
Yeah, exactly. This is the thing, isn't it? You never know what's around the corner. And in terms of a lot of sight problems, are most of them age-related, or are a lot of them sort of genetic things that we are prone to?
No, the most common operation performed of any kind in the world is cataract surgery. So eye surgeons do the most of any operation in the world, and that's an aging process. Cataracts come along. Everybody's eventually going to get one, and they have to have cataract surgery to be able to see again. So then, other conditions like glaucoma, which increases with prevalence as we get older. Macular degeneration is called age-related macular degeneration, which tells you it's a age-related thing, right? There's the so-called AGE syndrome, where you pick up problems. So the average number of problems that somebody's going to have in their 40s is one. In their 60s, there's going to be two on average, and in their 80s, they're going to have an average of 3 eye problems. So that means some have more than three, and they're all related to getting older, unfortunately. But it's good. We can actually take care of these problems in many cases. Some we cannot, but there are developments taking place to help. And I think that in about 10 years we'll see quite a shift in therapies, less surgery and more compounds and molecules to try and change how we regenerate our eyes and the components of our eyes.
You've done so many procedures over the years. I mean, thousands and thousands of operations. But behind the science, there's always a lovely human story, and there must be some really standout moments in your career where you can think of patients whose lives have been transformed.
Oh, it happens a lot, especially during sight restoration, during corneal transplants, for instance. Even a cataract. I had somebody who had lost their first eye from cataract surgery about 40 years ago and just refused to have anything done further, and he went blind. And he eventually came to see me, and I convinced him that really he was losing years of enjoyment. We did his surgery, and he walked out of the operating theater he saw his daughter for the first time ever. He'd never seen her. And that was fantastic. And that's what gets us really going. That's an extreme situation, 40 years of blindness. We've had patients who've had acid injuries, where we've restored the surfaces of their corneas with the stem cell transplants, and then done a corneal transplant. And again, after 20-something years, they're able to see again, traveling now by themselves, no white stick anymore, and no assistance. So yeah, it is fantastic. And I don't see this really as a job. It's more like a hobby. It's fun, and as I say, it gets us out of bed in the morning.
There's been so much talk recently about AI, and inevitably AI is going to make a huge difference in the world of medicine. What difference is it making in the world of eye surgery?
Well, I think it's overall medicine. So when it comes to eye care, there are some great AI developments to do with making diagnoses. So and find that sometimes they're more accurate than humans. They also pick up things that mortal humans can't pick up. So, for instance, there's a big program that Morpheus were heavily involved in it, where they had retinal pictures to pick up diabetes and macular degeneration. Not only could it do that very, very accurately to percentages in the high 90s, it could also determine the age of the person as well as their sex. Now, we don't know how to do that by looking at the back of the eye, but AI can do it. So there's a lot that AI can do that we can't, and it's because of the way in which AI works with neural networking. And there's no way we can figure out what exactly it is it's looking at. It's looking at a whole bunch of variables. So there's a giant leap taking place right now, and we just have to be careful, though. This still needs to be monitored, and it needs to be regulated, because it could come up with some absolute rubbish too. So for those listeners who use ChatGPT to try and diagnose their problems, they're not always right, and there's a bit of hallucinating that takes place at times in terms of what the diagnosis is. And now I notice that ChatGPT and others are putting a little rider saying, we're not doctors, we're just giving you possibilities of what could be wrong. So it's good, but it has to be moderated. And I think for a long time there's going to be a lot of human involvement in monitoring and ensuring that it makes sense and does not lead us all astray. But it's going to be fantastic in removing burnout. So AI is being used now a lot, and we're hopefully adopting a system to reduce our burnout. So all our investigations will be pulled into our medical record system, and all the little numbers will be put into fields, and AI will help us analyze the suitability of patients for different procedures and guide us. Because right now what we do is we have to use our head and go through every single detail. That takes a lot of work. It takes a lot of time too. And sometimes we're humans, we might miss something. Well, AI is unlikely to do that. So it should reduce burnout, because, as you know, and you probably read about it, doctors are getting burnt out. No matter what stage in their careers, they're all getting burnt out. And it's because there's a lot more work to do, and it's really trivial pursuits that they have to do, but they're important trivial pursuits. They're required, and that could be replaced by technology quite easily. And that's what we're looking forward to that. So we can spend more time in the operating room theatre or seeing patients and making decisions, as opposed to doing paperwork and thumbing through investigations and so on.
What does a typical day look like for you once you've finished this interview? Busy afternoon ahead for you?
Very. I got a lot of patients to see from yesterday. I did surgery on yesterday, and a whole bunch of new ones coming through with second opinions, and again, they're challenging, but should be a fun day.
Well, it's always a pleasure to have you on. Thank you so much for joining us as our lunch break guest. So 30 years, 1996 founded Centre for Sight, one of the UK's longest established centres for advanced eye care. And during that time, there have been so many developments and changes in treatments for various eye conditions. Delighted to have our lunch break guest onto the programme talking about that today. Another lunch break at the same time tomorrow.
Pat Marsh, BBC